I'm Raj Bhutani. I'm one of the gastroenterologists here with Eastside Endoscopy Center. We offer endoscopic services that includes upper endoscopy to diagnose and treat problems and complications related to chronic heartburn and reflux, ulcers, other types of stomach and small bowel and esophageal problems, and of course colonoscopy and evaluation for colon cancer screening. We were actually one of the first endoscopy centers in the state of Washington, and we actually were the first one that was nationally accredited to perform these procedures in the outpatient setting. And I think as we've grown, we've just continued to hone our skills and become better and better at what we do. We have a total of 10 gastroenterology physicians who work at our center. Everyone in our center is exceptionally dedicated to providing the highest quality patient care in terms of both office care and procedures, and they're all very skillful in what they do.
My name is Roanne Sellinger. I'm a gastroenterologist, and what that is it's a doctor who specializes in treating people who have issues of the stomach, intestines, and liver. The procedure itself usually takes about 20 to 30 minutes. Your total visit for the procedure usually is about an hour and a half to 2 hours. There's a couple misconceptions about colonoscopy. A lot of people are concerned that they will be very uncomfortable during the procedure. We have nurse anesthetists who are here to sedate people and monitor them to make sure that they are not only comfortable but also having a safe procedure. The other concern that a lot of people have is the feeling that they'll be exposed, and so we are very sensitive about people being nervous about the procedure and try to respect that and put people's fears at ease.
I've recommended people to see Dr. Sellinger who are co-workers, who are friends and associates, and people new to the area, anyone who's looking for a gastroenterologist that they might feel comfortable with, and I think that they would.
The Eastside Endoscopy Center is actually one of the only centers of its kind in the region that has dedicated anesthetists who are there just for the specific reason of ensuring patients' safety and comfort and monitoring during their procedure in terms of their sedation and pain control. And we actually offer those services both at our Bellevue location and our latest location in Issaquah. When a patient comes to our center, which is a type of ambulatory surgery center, it's actually a very efficient operation, and we translate that efficiency into lower costs, where typically the costs are less than half of what patients might pay for having similar procedures and services done at a hospital.
I try to put people at ease by relating to them. I've had the procedures myself, so I know the fears that that can instill, and I also know the discomforts that are potentially there. We have nurse anesthetists also who will talk to them before the procedure to make sure that any concerns that they do have are addressed.
Well, I think the most important thing is the understanding that this isn't necessarily routine for them, and they're often quite nervous when they come in because they're not used to these types of procedures, and we try to do our best to put ourselves in their shoes. Use a little bit of humor to kind of put them at ease, and really just understanding that we recognize it's a different experience for them, and we try to make it as positive of an experience as possible. The center's open from 6:30 a.m. to 4:30 p.m. Monday through Friday. If you'd like more information or would like to make an appointment to see one of us or consider having a procedure performed such as a screening colonoscopy and haven't gotten around to it yet, I encourage you to check out our website, give our offices a phone call, and we'd be happy to see you anytime.